Would you like to elaborate more on the root causes of these hair fall?
Yes, yes. So whenever a patient comes, the first question she says is, Doctor, I'm having a lot of hair fall, but I don't know why. And it is our duty to find out that why the patient is losing hair and what is the reason behind the hair loss. Otherwise, it cannot be treated. So whenever you go to a doctor for hair fall, always remember, uh, the doctor who just writes down medication without understanding why you're having hair fall, or just suggests some treatment like go for PRP or go for this type of treatment, it's not the proper way, because finding out the exact cause of hair fall is very important. Now, the first most important cause of hair fall which we are seeing in females nowadays is hormonal. PCOD, which is rampant, menopause, thyroid, hypothyroidism, and hyperthyroidism both can lead to a lot of hair fall. PCOD, again, insulin resistance, and during menopause also. I'm going to take menopause as separately, why it leads to so much of hair problems. We'll talk about it. But in every life, in our life, in every part of our life, there are certain hormonal changes which are happening. Like in teenage menarche, like when the periods start, there is hormonal changes. Then when you are going through a postpartum or pregnancy, postpartum, there are so much of hormonal changes happening. And then comes the perimenopause and the menopause. So in all these stages, hair is affected in different ways. Okay. Second
Okay.
is nutritional deficiency, and which is again very, very common. Nutritional deficiency, we can see, is again one of the major causes of hair loss. uh, Now when we check our nutrition, like when we check do the investigations, it is not possible to check every nutrient in the body, isn't it? So sometimes it goes undiagnosed. Like, I had a patient who came to me with all the tests done. Like, she had done her CBC, she had done her vitamin D, vitamin B12, even thyroid, even some hormones were already checked. But still the hair loss persisted. Everything showed okay, like it was normal.
Mm.
Later, we investigated a little more and found that ferritin, which is the stores of iron, like, though her hemoglobin was okay, her ferritin was low, and that was the cause of her hair loss. So, it is
Oh,
very important to go even into the depth of what is the nutrition part, like, whatever, what is the patient eating, how, what are they consuming throughout the day, that is also very important. The example which I was giving you before, like the 28-year-old girl who was so depressed, and so when she came, she had whole lot of investigations. She had, like, she was doing everything perfect, I would say, sleeping on time, taking care of her diet. She was having all her multivitamins, like she was taking biotin, she was taking iron, she was taking vitamin B12, everything was perfect. But when I went into the entire depth of her diet, I found out that 2 years before this hair loss, she had she was uh, she used to eat non-vegetarian food, but she turned vegan at that time. And there is
oh,
no way to check your protein levels. And that's what I realized in her, that somewhere the protein lack, hair is a protein, basically, it is made up of keratin. So the protein lack was the problem which was leading to so much of hair loss. And imagine, it was a small thing, but it led to so much of problem. And then we treated her hair loss, and she has sent us a very beautiful review or a testimonial, which, it's the last or second last slide. If we can go to that, I just wanted to show that. One more, one more slide. Yeah, see here. She has written so well that I noticed a miraculous growth and recovery, which is so nice. And she has written that, Dr. Ruchi, dug deep into my issues beyond the external capacity. She suggested other areas that could be affecting my imbalance. So, hair is not just hair. Hair is just not about shampoos and applications. It is much deeper than that. The next reason for hair loss is again stress, which we are seeing so common nowadays. Everybody is stressed. Everybody is going through some or the other mental health issues also. Then are medications, certain medications like antidepressants, certain blood pressure medicines also, some hormonal treatments also can lead to hair fall. Here, we cannot, some medicines we cannot change, isn't it? We cannot stop them from taking certain medicines. So we have to work with that and give them the healthy hair with that. One very common reason which I'm seeing nowadays is crash diet. When you are, because anytime when you lose a lot of weight, your body is going through a shock. Like what I was saying, that any shock or any trauma to your body or to your mind can lead to a lot of hair loss. So when you go through a crash diet, suddenly you see a lot of hair loss. So that type of hair loss we are seeing very common nowadays, because everybody is on some or the other diet. And uh, this like in my experience, one more thing which I have seen, people are going for these weight loss drugs, which is Ozempic and Munjaro and this type of drugs, which are sometimes essential, sometimes needed. After this also, I have seen many patients losing a lot of hair because they suddenly lose weight, and in this lot of muscle mass also they lose, so protein is falling short. They are falling, though they are taking a lot of supplements also, their doctors do recommend, but like I told you that every nutrient cannot be supplemented. So
Correct.
this is a type of hair loss which we are seeing commonly. Another is postpartum, like after delivery. Now, after delivery, there are certain causes, like during pregnancy, estrogen and progesterone levels are very high. After the delivery, your estrogen levels suddenly drop down, and uh, estrogen is the hormone which keeps your hair in the growing phase. Okay, and because of sudden drop of this hormone, suddenly you can start losing a lot of hair. And see, when the mother is lactating, she's feeding the baby, say till the third or the fourth month, the baby is only taking mother's feed. So everybody is taking care of the mother also. They are giving her good food. She is taking care of her nutrition. She is taking her supplements. After you start weaning the baby, the mother also takes like it easy on the supplements. She doesn't take care of her food. She's trying to lose some weight. The postpartum weight loss also can lead to this. So combined, the hormonal changes as well as the nutritional changes can lead to a lot of hair loss postpartum also. So this is also one of the very common reasons. So these are some of the reasons why you will have lot of hair loss.
Okay, wonderful. This topic is becoming more interesting for me because I'm gaining so much information which I didn't know before. Thank you so much for that.
And
So,
one more thing, sorry, Anjali, to interrupt you, but I forgot about one more thing, which also is uh, I am seeing this type of hair loss also very common nowadays, is excessive use of chemical treatments. That means, people are visiting the hairdressers commonly, and then a lot of heat, lot of chemicals are used on your hair. Even young girls, like I would like to tell you here one small story. Sorry, I'm telling you a lot of experiences and small stories.
no
So
worries.
nowadays, even young girls, like girls going to school, I have a friend, her daughter in school was sent home because she colored her hair when she was in the school. Okay, and
Okay.
my friend was also very upset, and her daughter was very upset that, like, how can they not allow us to color the hair? But
Hmm.
I mean, what is the need, uh,
Correct.
of using so much of chemicals on your hair? Where it is required, it's fine, but these are unnecessary things that we are doing nowadays. People, good hair is one thing and perfection is another thing. We want to be perfect. Okay, I have good hair, but my hair is curly, I want it to be straight. I have straight hair, but I want it to be curly.
Correct.
So there is where a lot of chemical use, And heat is used on the hair, lot of like iron, blow dryers. I'm not against styling, but use it in minimal as much as you can. Don't use lot of hot air. You can do a blow dry, but you can dry your hair with cold or medium hot air, no? So you don't damage your hair. And I think the generation before us started coloring their hair very late, like when actually they had a lot of gray hair, or only when they had some event or something. We started coloring the minute we saw two, three strands of white hair, gray hair in our scalp, we started coloring. Our next generation has started coloring even before the hair would gray, or even like just
Just for fashion.
different hair color. You know, so that much is the chemical use nowadays, and there are so many chemicals in all these products which are used on the scalp. And nowadays we are reading that this person got like this type of disease after using a hair color. There are so many side effects. Okay, so
Yeah.
again, I'm saying that I'm not like, okay, don't use anything, but as much as possible try and use minimal. Okay, this is one message very important that I wanted to give.
Wow. Thank you so much.